Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From Boundary to Bear Lake, Fremont to Payette, Oahe to Oneida, there are interesting people, places, and histories in all of Idaho's counties. And Idaho Matters wants to share it with you with stories from all 44 counties that make up the Gem State. Email your ideas to idahomatters@boisestate.edu or use the Talk to Us feature in our app, available on Apple and Android, and tune in each weekday at noon for Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Across the United States, there's growing concern over our nation's infant mortality rate. After years of steady improvement, recent reports show that more babies are dying before their first birthday, raising alarms among health experts. In fact, the state of Mississippi has declared a public health emergency over this issue. Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
Now, folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, let's dive right into this. Can you tell us a little bit more about this public health emergency in Mississippi? Because I have to tell you, when I read this, I had to do a double take, Dr. Pate.
Yes, it's a real concern what has happened in Mississippi, but I will tell you that Mississippi is not alone. But I do think that their health leadership is taking a very proactive stance, and I applaud them for this. What Mississippi has noted is that when you look at infant mortality rates, so what we do is we look at children from the time of birth under the age of 1. And you look at the mortality rate, so the number of deaths per 1,000 live births. What Mississippi noted in their 2024 data was that rate had gone up to 9.7. In other words, almost 1 in 100 children were not making it to their first birthday. And that would compare nationally. That's about double what the national infant mortality rate is. So they did declare this emergency to try to bring attention to this issue, to try to mobilize resources to address what some of those root causes of the higher infant mortality rate might be.
And Dr. Pate, what are they suggesting are some of those root causes?
So they feel like, in looking at the data, that they certainly are having children with congenital malformations, but areas where they can probably make a big difference are premature births. And so just children being born too early, children with low birth weights, and SIDS, the sudden infant death syndrome. And so those are areas that really do present an opportunity, because for reducing premature birth and low birth rates, the key there is prenatal care. So do these moms have access to care? Are they getting in? Do they have the insurance coverage or Medicaid? Do they have access to providers who can give them prenatal care? What are those barriers, like transportation or getting off from work, those kind of things that they might have? And then education about how to minimize the risk of SIDS, and in terms of how we position the babies in their cribs, not putting blankets and other objects in the crib with them that might contribute to suffocation.
And Dr. Pate, you mentioned access to care. This was something that that health officials in Mississippi talked about, but this is also a growing concern across the country. And that is the fact that access to care, as you mentioned, there are all of these issues. One of the big issues, though, is that there are not enough OBGYNs, in particular in rural areas, and health officials in Mississippi stated that as one of the concerns for this. I want to dig a little deeper into this because this is an issue that's hitting Idaho as well. In fact, there was a study that was published just last month in the JAMA Network Open. This is a division of the Journal of the American Medical Association, and it found that Idaho lost 35% of its doctors who practiced in obstetrics since the abortion ban went into effect. So that means in total, the Gem State lost 94 of our 268 OBGYNs between August of 2022 and December of 2024, according to this study. Here's the thing that shocked me. That only leaves 23 OBGYNs to serve more than 500,000 people in the state of Idaho, because the majority of the remaining OBGYNs are in our most populous areas. So, Dr. Pate, we do not have a health emergency like Mississippi has declared, but we could potentially go down that path when we're talking 23 OBGYNs for 500,000 people.
Oh, and I suspect we are on our way headed for trouble because it's really a double whammy. It's the first issue that you just mentioned. It's not like we had a plethora of OB-GYN physicians to begin with.
Mm-hmm.
We already had shortages. And then on top of those shortages, as you said, we just lost more than a third of those physicians from our state because the change in the laws and fear of doctors' practice being criminalized and what that can mean. The second issue is the Medicaid cuts in Mississippi. Medicaid finances 6 out of 10 births, and they didn't
Mm.
expand Medicaid in Mississippi. At least we did here in Idaho. Um, in nationally, Medicaid pays for 4 in 10 births, and as you well know, the Congress has and President Trump has signed into law a bill that is going to significantly cut that Medicaid funding. So the combination of losing OB-GYNs and cutting Medicaid funding is going to put us on a path for higher infant mortality. And that doesn't even factor in another story that we'll get to, and that is the declining vaccination rates
Mm-hmm.
and what that's going to do over time as we start seeing children dying of vaccine preventable illnesses. So, everything is set up to go in a bad direction.
And Dr. Pate, I want to go back to, when we talk about this shortage of OBGYNs, right? We're feeling this in Idaho. We're seeing this in other areas of the country, especially in rural areas. I think sometimes we focus on, when we think of an OBGYN, it's the baby doctors, right? They deliver the babies. OBGYNs do so many more things. I mean, women need OBGYNs outside of prenatal care, right? And I mean, this is,
Right.
we go to our OBGYNs for our annual breast exams. We go for our annual gynecological exams. These are the doctors who are finding any type of health abnormalities for women. And now there are longer lines. It takes longer to get in to get your mammogram. I mean, if you don't get that scheduled, you're going to be lucky if you're going to meet that deadline. That yearly deadline, right? It might be 6 months out. This is no fault, I believe, of hospitals or of doctors. This is the fact that we don't have access to the care that we need as women.
Yes, yes, I agree, and as I would even add on to what you said, not only all of those things, There are many women who see OB-GYNs for all of their primary care needs, especially if they tend to be healthy. And also, we were just talking about with that infant mortality rate, how important that prenatal care is. So it's not
Hmm.
just delivering the baby and so forth, it's all that goes in beforehand. And then there are gynecological problems that
Hmm.
women have that don't have anything to do with having babies, but that OB-GYNs play a great role in. So certainly, our family physicians, we have other physicians who can kind of help to step up to try to take care of some of this need. But the problem gets to when you have complicated pregnancies and you need extra expertise. And sometimes in some of those most high risk pregnancies, you need maternal fetal medicine physicians who are the OB-GYNs who have gone on to get additional specialized training, and we're losing them too. So it is, as you mentioned, a very serious problem. And unfortunately, I don't see anything that to tell me that there's a really serious effort by our state legislature to address this, or that things are going to get better. They're talking about maybe buying a medical school. That will not fix this problem. So I am certainly concerned.
All right, Dr. Pate, we mentioned this briefly about vaccines in our last segment. I really want to dig into this for a minute because the American Academy of Pediatrics recently released their new COVID vaccine guidelines. And for the very first time, they diverged significantly from the CDC. So, Dr. Pate, can we start with what those new COVID vaccine guidelines are from the AAP?
Yeah. So this is the American Academy of Pediatrics, who this organization was giving out childhood vaccine recommendations before the CDC and the Advisory Committee on Immunization Practices ever did. When the Advisory Committee for Immunization Practices under the CDC was formed, it added AAP members, experts onto it, and the benefit was to bring in additional experts. And so they have been giving the guidance. I am delighted that the Academy of Pediatrics has gone back to that historic role in issuing guidance because basically the new revised ACIP in the CDC, as my kids would say, they've gone cray cray, and they are issuing. It's just nonsense, and it started really what caught everybody's attention that is knowledgeable in these areas, and certainly caused my jaw to drop. Was when the Secretary Kennedy came out in a video and said that the CDC would no longer recommend vaccines for pregnant women. I mean, we all just about fell out of our chairs because
Mm-hmm.
even the CDC and it had recently even published a paper showing that the pregnant women were in the high risk group, and to now say don't vaccinate pregnant women, especially when, as you and I have talked about over the last 5 years, one of the great benefit of vaccinating pregnant women is you transfer antibodies to the
Mm-hmm.
baby, and the baby cannot get the COVID vaccine and most vaccines until 6 months. So it relies on these antibodies. We're making by not vaccinating the pregnant moms, we're making these 6 month old up to 6 month old infants extremely vulnerable. And as I mentioned on a previous show, that if you look at by age group, who's most likely to get severe disease and end up in the hospital with COVID, the top group, nobody will be surprised, is those 75 and older. If I asked your listeners, what is the second highest rate group to be hospitalized with severe COVID, they'd probably say, well, 65 and older, and they would be wrong. It's 0 to 6 months. And
Mm.
uh, it just tears me up because these little tiny infants are at more risk than I am to end up in the hospital. And so this has really got everybody's attention. And then when we saw the new makeup of the vaccine committee and the nonsense that they're talking about, I am so proud that the American Academy of Pediatrics and some other organizations are stepping up and saying, look, we're going to put out good information for people that want good information. And so they issued their advice. And what they pointed out is that really the highest risk of all kids to end up seriously ill and die is all of those children under the age of 2. So they came out
Mm.
with a strong recommendation that they should get the COVID vaccine, and they should get it. If they got it last year, they should get it this year, get a booster. But they also recognize and point out that really all children can benefit from the vaccine because it's not just death and serious illness that we want to prevent, but recognition that kids get long COVID as well. It's not just adults. And also, we talked in the past about a disorder called MIS-C, which older kids tend to get and get seriously ill. But this recommendation is a recognition that although our older kids may have been vaccinated, almost certainly have had infections, these younger kids are coming into the world without that background, and they need to receive the vaccine to try to prevent them from
Hmm.
getting seriously ill.
Well, and then another issue with this, Dr. Pate, is that insurance companies usually look at the guidelines from the CDC's advisory committees, and then decide if a vaccine will be paid for through insurance. And so you mentioned this new it's not a new group, but it's the advisory committee on immunization practices, and this is the people that were taken off the board that Secretary Kennedy has now put on this board. A lot of them have anti-vax views. So now here's another issue that could potentially come up is that if ACIP declines to endorse a vaccine, does this mean that families will end up having to pay out of pocket because there's this federally funded program, Vaccine for Children, and so that's also an issue, is that even if the American Academy of Pediatrics is diverging from this, and I think the majority of us listen to our pediatricians, a lot of folks can't afford to vaccinate their children if they're going to have to pay out of pocket.
You're exactly right. And that is, in fact, the fear is that if these vaccines are not part of the official vaccine schedule and recommended, that under law, then insurance companies would not be required to cover their cost. Now, the good news is that AHIP, which is the let me think, American Health Insurance. Something. It is the national group of health insurers,
Hmm.
health insurance plans. That's what it is. They have already come out with a statement and said that they will be looking to other guidance to make their coverage decisions because an insurance company understands that it is much better for them to pay for $100 vaccine than to pay for a $10,000 hospitalization. And so I think this is our potential saving grace, that these insurance companies will just they'll look at the guidance coming out of the American Academy of of physicians, the Infectious Disease Society of America, and others, and they will look to that guidance and their own. They know the evidence for how vaccines well, and then we are hopeful that those plans will continue to cover this. But that is the fear, and there may be some disruption and a little chaos in the meantime till it all gets worked
Hmm.
out.
And we should note that this recent recommendation from the American Pediatrics Society, the American Academy of Pediatrics, they also recommended it wasn't just COVID. I mean, it was influenza, it's RSV, right? So
That's
I'm
right.
sitting here thinking, and I'm sitting here thinking, we're at the end of August, and you and I, Dr. Pate, normally start talking about the flu vaccine, and I mean,
That's
we can
right.
get into this on another day, but I'm like, when are we going to know more about that, right? I mean, there's this domino effect of how this is impacting everyone.
Oh, without question. Just to briefly touch on this, and like you say, we can discuss this in future segments. Although right now you are seeing some pharmacies advertise a flu vaccine, it is too early to get the flu vaccine right now. Uh,
Hmm.
we will cover on your show, just like we did last year. We'll follow the activity. Once we start to see influenza activity, which we are not seeing at all hardly right now, then we'll let you know when's a good time to start thinking. It's probably going to be in late Octoberish, but could be. Sometimes it's early, sometimes it's later. We'll let you know, but it's too early to get the flu shot right now. The COVID vaccine, the updated vaccine is coming out. We've been led to believe that it will be distributed widely next month, which we are just a few days short of. I
Hmm.
think some pharmacies may already have started getting it, but it is fine time right now to get your 2025 to 2026 updated COVID vaccine. So you can, especially if you qualify under the existing criteria, you can go into a pharmacy, check to see if they have it. If they have it, you can get it. If they don't have it, they're going to probably have it over the next 2 weeks, and it's fine to go ahead and get that.
Before we go to break, Dr. Pick, I want to talk about something else really quickly in regards to COVID vaccine, and that is the fact that the American College of Cardiology just released vaccine guidelines for adults with heart disease. So tell us about this.
Yeah, this was welcome news. I have been telling your listeners for the last 5 years that people that have heart disease are in the high risk group. And the American College of Cardiology points out in their new guidance that if you have underlying heart disease, you are 3 times more likely to develop severe disease and die from COVID than if you don't have the underlying heart disease. And so they are really making the point, and like you just commented about the AAP guidance, it's not just COVID vaccines; they also address influenza and other vaccines as well. But that they do make the point. It's very important if you have underlying heart disease that you do get vaccinated because you are in the high risk category, even if you are not elderly or older. So
Mm.
that was really good advice. And I'm so glad to see many professional organizations coming up and standing up and telling people clearly what the science actually does support.
Dr. Pate, in the middle of the worst measles outbreak in decades here in the United States, Idaho is now reporting 3 cases of measles as of last week. And these 3 cases were all in unvaccinated children, 2 in North Idaho, 1 over in East Idaho. Here's what I found interesting about this. Our state epidemiologist, Dr. Christine Hahn, was interviewed by the Idaho Capital Sun. And what she said in that article is that the disease is likely spreading more. Can you explain what she meant by that?
Oh, absolutely. And Dr. Hahn is amazing. Most people probably don't know her, but we are so lucky to have her as our state medical director and epidemiologist here. And I totally agree with her. So if you remember back in the very beginning of the COVID pandemic, we were talking about the first cases of COVID, and we were doing contact tracing. And what was happening is, for the first couple of weeks, as I recall, most cases we could tie it to another case. And when that is happening, then you don't have community spread. But then
Mhm.
when it began happening where we were having cases, but it we couldn't find that there was a family member or a coworker or somebody that gave it to them, then you're realizing people are getting infected in the community at large, and we call that community spread. So Dr. Hahn, I think, is exactly correct that given we've got this one case in eastern Idaho, we have two in northern but separate counties, and no connections. It's not like they are all part of the same family. They got together for a family reunion. There's not some way to connect it and identify where they got infected from. When that happens, you make the assumption, and it's almost always right, that it's actually circulating in the community. And this is not surprising that it would. That's what measles does. Some cases of measles are going to be mild and won't end up going to a doctor or a hospital and getting reported. So there are probably many, many more cases. And this is not going to be a case where we're going to see this come to an end. I suspect we will see far more cases and far more spread. And we knew this was inevitable. And in fact, Gemma, you and I talked on the show when it was we were seeing measles cases in neighboring states, and I said it's just a matter of time. Then we saw wastewater from Coeur d'Alene turn positive on July 29th, and we talked about it's just going to be a matter of weeks until we start seeing cases, and here we are.
And Dr. Payne, can we talk a little bit about, not just community spread, but this idea of herd immunity, right? Because Idaho, historically, we have lower vaccination rates than other states, and I believe I think the latest numbers we have may have been from the 23-24 school year, and this is according to the Centers for Disease Control and Prevention, that here in Idaho we had a 79.6% vaccination coverage of the MMR vaccine, so measles, mumps, rubella. How is that going to be playing into the spread of measles potentially? Because we're back in school, and I mean,
Yes.
my oldest kiddo came home 2 days after school started with a cold. I mean, you forget how quickly kids pick stuff up at school.
Oh, yes. Well, what is going to happen is it's going to be daycares and schools. And so you're right. This is the worst time for us to be having an outbreak of measles because these kids are going to be socializing and spending a lot of time together because it's the school year. And with respect to herd immunity, what we still fail to learn is not every virus gives you the opportunity for herd immunity. For example, we do not have herd immunity to the SARS-CoV-2 virus for COVID, but measles, thank God, and it's because of the fact that there is long-lasting immunity, essentially life immunity from infection or vaccination, that does make herd immunity possible. However, measles is one of the most contagious viruses that we know of, so it requires a very high level of that herd immunity. In other words, the population that is vaccinated. And it is, by most estimates, we need about 95%. And
Mm.
so, obviously, we don't have those levels of vaccination. So, this is not surprising that we're having outbreaks of this. And that 95% that's required, what that does is that protects, like, the infants that we were just talking about. If you have
Mhm.
95% of people vaccinated, then the virus can't really make inroads very effectively. It keeps getting blocked everywhere. And that is what helps protect immune compromised people, people undergoing chemotherapy, little infants, that kind of stuff. That's why we need to be vaccinated so that we can protect other people. But also, people forget that while many people do fine with measles and recover, there are lots of serious complications that can occur with measles.
So, with our last couple of minutes left, Dr. Pate, I want to talk about something that I experienced last week. I went to pick up a prescription at my local pharmacy, and there was a woman standing next to me picking up a prescription, and the pharmacist said, "Oh, and you are due for your RSV vaccination. If you'd like to get that today." She was an elderly woman, and so she had them explain to her what RSV was. But then she asked, "Well, why do I need to get this?" The pharmacist explained to her, but then he said the reason why we are letting people know when they are eligible for a vaccine of any kind is because we're not sure what's going to continue to be covered or not. And so we want all of our folks who come into our pharmacy to know that they can get this vaccine right now and that it's covered right now. Dr. Pate, I've never seen something like that happen before. And I'm curious to know your thoughts on that because I was kind of like, well, good for the pharmacist for letting folks know about this.
Amen. I would love to give that pharmacist a hug. Yes, we have never seen anything like that or heard anything like that before because we've never seen what we're going through right now. People may not appreciate the full assault that is happening on public health and particularly vaccines from the highest levels of our government. I share that pharmacist's view. I am, I spend a lot of time, uh, probably more than anybody listening to the show, following carefully what are these leaders saying, what are they, because you can tell in the things they say. I am quite confident that they are going to go after many of these vaccines. It's not just COVID. They're going after many of these
Hmm.
vaccines. I can already tell RFK Jr.'s got HPV on his hit list. That is terrible because that is our first really, I mean, amazingly effective vaccine at not only preventing HPV infection, but preventing cervical cancer. So
Cancers.
I think that pharmacist, cancer, cervical cancer, and I think that pharmacist is right. We cannot take these for granted. They may not be around. And I think they are under attack, and it is, he gave wise counsel.
Well, I appreciate all of your counsel on this program, Dr. Pate. Thank you so much for joining us. Dr. Pate is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. As always, Dr. Pate will be back with us next week. So if you have a public health question, send us an email, idahomatters@boisestate.edu. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.